All right, let's jump right in. We're going to talk about a huge part of the healthcare system that's kind of hiding in plain sight. It's the world of self-care and, maybe more importantly, the expert you probably see all the time, your local pharmacist.
So picture this. You get that first little tickle in your throat, that first sneeze. You know the feeling, right? It's something we've all experienced. But what you do in that exact moment, well, that kicks off a surprisingly complex journey. So what do most of us actually do? The numbers tell a pretty clear story. A full 2/3 of Canadians just wait and see. They hope it goes away on its own. About a quarter of us go straight for the medicine cabinet. And then a small slice, about 10%, decides to get professional help right away. And this isn't just random, you know? It's a personal calculation we all make.
So let's really zero in on that first moment. That sneeze isn't just a sneeze. It's the starting gun for a whole series of decisions.
That's right. The second you feel sick, it's like you're running a personal algorithm in your head. You're thinking, okay, how bad is this really? Is it going to ruin my day? You're weighing all your options, thinking about your health, how much things cost, what's worked before. Your own little health command center just lit up.
And that brings us to the first tool pretty much all of us use in this situation. It's this thing we call self-care. But what does that word even mean? Let's break it down. Now, this official definition is really important because it totally reframes the idea. See, self-care isn't just about what you do when you're already sick. It's a proactive, ongoing thing you do to stay healthy and manage whatever comes your way, big or small.
A great way to think about it is on a spectrum. Over on one end, you've got stuff you do completely on your own, like brushing your teeth. And way on the other end, you've got something like brain surgery. Definitely not a do-it-yourself project. And right there in the middle, that's where stuff like recognizing your symptoms and, yeah, talking to a pharmacist fits in. It's all part of the same picture.
So to really get a grip on this, it helps to have a framework. And luckily for us, the International Self-Care Foundation has broken it down into 7 key areas, 7 pillars.
And here they are. Now, what's really fascinating about these 7 pillars is that most of them, things like being active, eating well, good hygiene, they're all about preventing sickness in the first place. And the research shows they're all linked. If you get better in one area, like you stop smoking, you tend to improve in the other areas too. It's a domino effect.
Okay, so you've noticed you're feeling off. You've decided you need to do something. For so many of us, that leads right to a crucial fork in the road, the pharmacy.
You know this feeling? You walk into the cold and flu aisle and bam, it's just a wall of boxes. 50 different brands, all promising to fix the exact same sniffle you have. It's a lot. How are you supposed to know which one to choose?
And this is where what we think we do and what we actually do just don't line up. We all want to believe we're being responsible. In fact, 91% of us say we read labels carefully. But when researchers actually watched people, they found that only 1 in 10 read the warnings part when buying a new product. That's a massive gap.
And this puts your pharmacist in a really tough spot. You might go up to the counter and ask for a specific brand by name, but they have a professional duty, a real responsibility to make sure that what you're asking for is actually the right and safe thing for you. It's a balancing act.
This brings us to probably the most underappreciated resource in all of healthcare. So let's talk about the real superpowers of your community pharmacist.
Have you ever wondered why some medicines are just sitting on the shelf, but for others, you have to go ask the pharmacist? Well, this is why. Canada has a system for this. The stuff that's kept behind the counter is there specifically because you need an expert, the pharmacist, to make sure you're using it safely. It's a built-in safety check.
And the value of this whole system is just enormous. To get an idea of the scale, just look at the US. Over there, the data shows that for every $1 people spend on over-the-counter drugs, the healthcare system saves between $6 and $7. That's an incredible return.
So let's bring that back home to Canada. Those pharmacist interventions, helping you pick the right thing or telling you when you really should see a doctor, are estimated to save our healthcare system over $265 million a year. That's huge. And that massive number isn't just made up. It's based on an estimated 15 million consultations that happen with pharmacists about minor illnesses every single year in Canada.
That's 15 million times an expert stepped in to help, preventing bigger issues later on.
Okay, so all of this is building towards something really important. The role of the pharmacist is changing. It's evolving to meet the needs of a system that's pretty stretched thin. This is the future of care.
Now this is where it gets really interesting. Look at the overlap here. On one side, you have the top reasons people go to their family doctor: back pain, congestion, things like that. On the other side, the ailments that pharmacists in many provinces can now prescribe for. And look, they're often the exact same things. This is a massive opportunity to get people care faster and free up our doctors.
So, the big question is, does it work? Oh yeah, it works. A Canadian study on these programs found that an incredible 86.7% of patients said their symptoms got significantly better after being treated by their pharmacist, and patient satisfaction was through the roof.
The takeaway here is pretty simple. This isn't just an experiment anymore. This model of pharmacists prescribing for minor issues is proven to be safe, it's proven to be effective, and that's why it's expanding so fast across Canada and even around the world. It just plain makes sense.
So it all comes down to this. Your pharmacist is right there. In your community, you usually don't even need an appointment. They are an absolute treasure trove of medical knowledge. We already know they have the skills to do more to help us, so the real question isn't whether they can do more, it's whether we're ready to let them. Something to think about next time you feel that first sneeze.